And then 40 to 50 is where I strongly believe that this has to change.
Yes.
In Indian society, this has to change, where breast cancer screening is a area that is very, very underutilized here.
Yeah.
And not only in India, this is the exact same thing in Indian women in US as well.
Yes.
Because we think that nothing will happen to us, number one. Number two is, this is something only for people who have some kind of problems.
Yes.
And a simple mammogram, okay, where is an X-ray of your breast,
Yes.
will pick up so many abnormal lesions if you have,
Yes.
and it can be easily prevented before proceeding with to breast cancer. So I want to know the prevalence and estimation, some data about what is happening in India and for our community, and then what is your practice that you're seeing in the hospital, and what is about the mammogram picture.
Breast cancer, unfortunately, is the #1 cancer for women in India. And our work at Apollo Hospitals, looking at mammograms and following people, right, to malignant breast cancers, we find that the average age of diagnosis of breast cancer is actually 54 to 55 in Indian women. In Caucasian women, in Western populations, that's actually in the 60s, right? So for some reason, right, genetics, environment, a number of combinations, we actually, in Indian women, have the risk of breast cancer much earlier. Therefore, we have to screen earlier. Mammograms are the best way, gold standard in identifying breast cancer early. It's also uncomfortable. 99% of women I speak with say the first thing, oh my goodness, a mammogram. No, I don't want to do this because it's so painful. It's painful for less than 10 seconds on each side.
It's an X-ray, just an X-ray machine, correct?
It's an X-ray machine. It takes images of what's happening inside your breast. So you need to do the right and the left. And because of the nature of how the machines are built, you have to squeeze the breast, and that causes the discomfort.
I see.
Right?
I see.
But only if you do that are you able to see the different slices and be able to see clearly what's going on. It is uncomfortable. But let's just do it. And if you have a family history, especially on the maternal side, right? So a mother, aunt, grandmother, all on the maternal side, then your risk of breast cancer is much higher. So if you have family history, start in your mid-30s, right? If you don't have family history, it's okay to start in your early 40s. Make sure you do it at least every 2 years. If you have family history, annually from 35.
And also the same thing we talked about, metabolic syndrome, obesity, again, that increases the risk as well.
Absolutely. So family history is one, metabolic conditions, disorders of all kinds, right? Increases the risk as well. And as a result, this is something that and it's also, it's uncomfortable, but it's also something that we don't talk about.
We don't talk about it.
Yeah. We're embarrassed.
Correct. It's similar to a gastroenterology. We don't talk about constipation. We don't talk about anorectal disorders, hemorrhoids.
Yes.
Blood in stool. People don't come out because they think that, okay, it'll go away on its own.
That's right. A gas. Something
gas.
Right? Simple as that. We don't talk about it. It's embarrassing.
Embarrassing.
Right? We don't talk about the breast. It's embarrassing. Right? And therefore, we don't have these conversations. We don't share. We don't do a self-exam. Right? We don't do a self-exam. So yes, you could do a mammo once a year.
Can you talk about self-exam, that you can examine your breast by yourself?
That's right.
And looking for any nodules.
Yes. And it's actually, you touch, palpitate, massage, feel. And when you do it on a regular basis, right? When you do it on a regular basis, then you'll pick up the change. It's very hard. Suddenly one day you decide and you see, and then you don't know, right? It's about the change over time, right? That's the part that you have to become aware of. Oh, wait, this wasn't there when I felt it a month ago. Let me see what happens in the next month. And a good way, again, because it's a habit and you're not going to stand there and think, I should do it today, right? Good way to do it is right after your monthly cycle. right? Right after your monthly cycle.
Okay.
Good time
To remember.
to
as
remember,
well.
right? Let's just do it and take care of ourselves. And if there's any changes, any discolorations, right?
So look at it as well.
Look at it.
Look at
right?
it. Any discoloration.
Discoloration.
Any previously soft area now nodular.
Nodular. So that means harder.
Harder.
Right? Feeling of some pain. So when you press, there's like, right, sharp pain, or discharges from your nipple, right? All of these are signs, right? And therefore, watch for some of these things as well, along with, of course, the mammography, which gives you a much better sense as part of screening, even when the symptoms are not there. Right?
Correct. And why should we do this? So that we
catch
can
it early.
Catch it early. And if there is some kind of, let's say, nodule, okay, so we usually biopsy that.
Biopsy it, and the biopsy what will tell us if whether it is benign or cancerous, malignant,
or precancerous.
Correct. Right? And then what stage, and then working with, if required, an oncologist to figure out a treatment.
Correct. Usually what I've seen is when you screen like 40 to 45, I've seen so many of my friends where they are diagnosed with stage 1.
That's right.
1A.
Much easier to treat.
And just they remove it.
Yes, mastectomy, right? Or the nodules, lumpectomy. Right? And that's, you're done. You move on. And you live a perfectly normal life.
Correct.
Problem with not doing it and catching it later, right? In your late 50s, 60s, right? At that point, you're much, stage 3, 4. It may have spread.
I'll tell you an example of a patient that I saw. 60-year-old, 55-year-old comes in with jaundice.
Yes.
Okay, so jaundice is something that liver is not working.
Yes.
So when a liver is not working, we do an ultrasound. In ultrasound, all we see was cancer deposits in the liver. We asked about smoking, alcohol, nothing. Okay. Then she had some kind of breast issues for going on for a long time. So then we biopsied the liver. It turns out that it is a breast cancer spread to the liver. Okay, and this was around 50-56, and then the lifespan is very minimal.
That's right.
Stage 4, that's only like 6 months to 1 year on the best case scenario. So looking at this, the one thing I will never forget that lady said to me was, I wish somebody has told me that to get a mammogram between 40 to 45. And from that moment, I was like, why are we not doing this? So I tell in my channel, I say, every man should make sure their mom, their wife, their daughter, their sisters should definitely get a mammogram.
Yes.
Push them to get a mammogram between 40 to 45.
Absolutely. No, this is the number one message for women out there. Please get the mammograms